Welcome to Diamond Environmental Open Enrollment Period, Plan Year 2021. What is open enrollment? Open enrollment is a one-time-a-year opportunity in which eligible employees can make changes to their benefits for the new plan year. For example, you can add, remove dependents, spouses, and dependent children under the age of 26. You can change plan coverages. You can cancel some or all coverages. You can enroll in some or all coverages. How to enroll. Review your current benefit elections. This will be also available in the EASE portal. When you log in, you'll be able to see your current benefit and cost, along with your new plans and rates. Also verify that your personal information is correct in the EASE portal. If not, you can make some changes if necessary. Mandatory that all employees must log in to EASE portal at diamondprovides.ease.com to enroll or refuse each coverage. Even if you're not enrolling, you still need to log in and complete your enrollment. Or if you're not making any changes, you still need to log in and complete your enrollments. When to enroll. The open enrollment period runs from January 18th through February 12th. The benefits you elect during open enrollment will be effective from March 1st, 2021 through February 28, 2022. The deadline to complete your enrollment on the EASE portal will be February 12th. Who is eligible? New full-time employees working over 30 hours per week are eligible to enroll in the benefits on the first of the month following 60 days after their date of hire. When coverages end. Through Evolution Healthcare, your medical, dental, and vision will terminate on the last day of the event. So if you had a reduction in hours, you're going from full-time to part-time, or you're terminating, or you're leaving the company, these benefits will terminate on that last day of the event. Through MyEVHC, your medical, dental, and vision will terminate on the last day of the month. Your Mutual of Omaha benefits, life, disability, and accident coverages will end on the last day of the event. Dependent eligibility. Your legal spouse, children you claim through IRS up to the age of 26 are eligible for coverages. Please note you must enroll in order to add your dependents in any of the coverages. What's new for 2021? We are making some plan changes to your core plan and buy-up plan through Evolution Healthcare, and that's the emergency room services copay that will be changing as of March 1st, 2021. As of right now, your current benefits through the core for the emergency room, it's $150 copay plus 25% coinsurance after you have met your deductible of $2,000 for individual and $4,000 for family. As of March 1st, 2021, your core plan copay for emergency room is going to be $3,500 copay plus 25% coinsurance after you have met your deductible of $2,000 for individual and $4,000 for family. Under your buy-up plan, currently your copay is $150 copay plus 30% coinsurance after your annual deductible of $2,500 for individual and $5,000 for family. As of March 1st, 2021, under the buy-up plan, the copay is $3,500 copay plus 30% coinsurance after you have met your deductible. In addition to your core and buy-up plan, through MyEVHC medical plan, your emergency room services also has changed. Currently, your copay is 15% coinsurance up to $150. As of March 1st, your new copay is 15% coinsurance up to $200. Changes outside of open enrollment. After March 1st, unless you have a qualified change in status, you cannot make changes to your benefits during the year until the next open enrollment period. Below it lists the qualifying changes that you are allowed to make during the year within 30 days of the event. Employer contribution guidelines. Diamond Environmental Services contributions are based on the number of years of service for medical and dental. In this sheet, it will guide you through what tier you might fall depending on the number of years you've been working, and also what coverage you are enrolling in. For example, if you're a new hire and you've been there at the company for less than 12 months, through Evolution and MyEVHC, Diamond pays 50% of your premiums. Tier 2, through Evolution, if you enroll in any of the Evolution medical and dental plans, after 12 months and 1 day to 60 days, Diamond pays 70% for employee and 50% for dependents. Through MyEVHC, it'll be 80% for employee and dependents. Tier 3 level. With medical dental through Evolution, if you've been there more than 60 months, 1 day, which is about 5 years of service, Diamond pays 80% of your coverages and you pay 20%. In the Ease portal, you'll be able to see your cost based on the tier level you fall under. Your cost per pay period in 2021. This will list the cost per pay period based on the tier level. As I mentioned, in the Ease portal, you will see the cost based on the tier level you fall under. Your dental and vision cost through Evolution and MyEVHC. With Mutual of Omaha rates, please refer to your employee booklet or Ease website for individual rates based on your age and salary. If you have any questions, please direct all questions regarding your employee benefits to HR department, or you can contact our broker, Pickering Insurance Solutions, at 800-858-1207 or at info@pickeringinsurance.com, Monday through Friday from 8:30 to 5 p.m. Hablamos español. Thank you for your time.
Welcome to Evolution Healthcare Overview for Diamond Environmental's 2021 Open Enrollment. Open enrollment is the only time of year that you can make changes to your current elections, add a dependent, or add a coverage, or drop a dependent or drop coverage. Outside of open enrollment, the only other time you would be able to make a change to your current elections would be if you had a qualifying event. Qualifying events consist of marriage, divorce, birth or adoption of a child, death of a spouse or a child, or if your dependent on your plan is turning 26 and falling off due to the age limit requirements. Outside of that, you would not be able to make any plan, benefit, or tier election changes unless it was during open enrollment. This overview is going to provide you with information for what's new for 2021. Just a brief reminder who Evolution Healthcare is. We'll give a quick overview of the medical plan option that's offered through Evolution Healthcare, along with the dental and vision plan options. We'll discuss who Evolution CRX is, your Teledoc benefit for virtual visits, how to read your ID card, and a quick overview of your MyEVHC.com portal. Evolution Healthcare is one of the nation's leading benefit management companies providing employee health and welfare plans. In partnership with Trustmark, CVS Caremark, and Cigna PPO Network, we are excited to remain the plan administrator of Diamond Environmental's employee benefit plan. Here's a brief overview of the medical plans Diamond Environmental is still offering through Evolution Healthcare. The PPO plan, which has in and out of network benefits, along with the core plan, which is in-network only benefits. There's only been one minor change to the plan benefits for 2021, and that would be for the emergency room copay. The copay has been increased to $3,500 for emergency room visits. Keep in mind that if you are not having a true emergency and you seek treatment at an emergency room, then your services would not be covered. It's very important that you use the providers like urgent care or your primary care physician, a specialist, or even through the virtual visit Teledoc program when it's for regular routine visits. You should only use the emergency room when you're having a true emergency. Also keep in mind that Cigna PPO Choice Fund is only the network. It is not your insurance, and all eligibility benefits and coverage will continue to remain through Evolution Healthcare. It's important that you remind your physicians and providers that Evolution Healthcare is who they need to call to verify benefits and not with Cigna. Diamond Environmental is continuing to offer the dental plan through Evolution Healthcare. This is a PPO plan. It utilizes the Cigna SA network for dental services, and each enrolled member on the plan has a $2,500 per person per plan year benefit. Dental is broken down into 3 categories. Your class 1 or basic services, which include preventative routine cleanings, routine x-rays, and routine exams. And in-network, it's covered at 100%. And the deductible does not apply. Then you have class 2 restorative services or basic services, and this would be things such as root canals, fillings, emergency exams, and those benefits when in network are covered at 90% after the $50 individual deductible. Then there's class 3 or major services, and those are covered when in network at 60% after the deductible, and they would include things such as crowns, bridges, dentures, bridge work, crown work. And also for children under the age 18 enrolled on the plan, there's a lifetime benefit for orthodontia services, and those services are covered at a 50% in network after the deductible. Diamond Environmental continues to offer vision coverage through Avisus Vision. Avisus Vision did not make any changes this year to their plan, and you are able to get a routine vision eye exam every 12 months with a $10 copay when you see a participating provider. Frames are covered once every 24 months, and should you choose to elect to go with contacts versus glasses, you can have lenses and an exam for contacts every 12 months as well. Evolution CRX is another program that's in place for you and your covered dependents. This is a voluntary program that sits alongside your current CVS Caremark pharmacy benefit and plan. And if you or a covered dependent is taking a current medication that could qualify for savings on CRX International Plan, they will reach out to you by mail. If you want to see the current medications that are offered through CRX International, simply go out to our website by visiting www.evolutioncrx.com and look up the list of medications. All employees and dependents who are enrolled in Evolution Healthcare's medical plan will automatically be enrolled in the Teledoc program. Teledoc provides you virtual visits through board-certified physicians in your area for things such as common colds, flu, sinus problems, pink eye, rashes. Just simply go out to Teledoc's website, either through our Evolution portal and the MyLinks, or by visiting www.teledoc.com. Put in all your demographic information and any current medical conditions and medications you're taking. And anytime you need to seek treatment, whether you're traveling, you're at home, or while you're at work and you can't get to your normal primary care physician, simply visit a physician through Teledoc. It's quick, convenient, and super easy.
A quick overview of what your ID card would look like. On the front side of the card, it will list the member name, the member ID through Evolution Healthcare, and the group number. And on the far right-hand side, it will have the Cigna logo for your providers to know what your network is for contracted providers. It will also include your pharmacy information for your pharmacist to know what the RX BIN number, PCN, and RX group number is through CVS Caremark. On the back side of the card, it will list where providers need to call or log into to verify your coverage, benefits, and eligibility. All verification of coverage, benefits, and eligibility must be obtained through Evolution Healthcare and not through Cigna, as Cigna is only the network to find participating providers. If you're at the doctor's office and they tell you that they cannot locate you in the system or they're not able to verify your benefits, kindly remind them that all benefits must be obtained through Evolution Healthcare, and if they're looking in Cigna's website or contacting Cigna directly for coverage, you will not be in there, as your benefits and coverage must be obtained through Evolution Healthcare.
All enrolled employees will have access to MyEVHC.com, which is a personal online portal to your profile, claim submission, explanation of benefits, account accumulators for deductible and out-of-pocket max. This site you can customize to set up how you want to receive email alerts or text message alerts, how you want to receive your explanation of benefits, whether it's electronic or via paper. It also allows you to print ID cards, search providers in the Cigna network. It has direct links to Teledoc and your Caremark CVS pharmacy vendor. It's important that once you receive your ID number, that you go out to the www.myevhc.com and register. If you have not received an Evolution ID number, we ask that you please wait to register until you have obtained that number.
Once you've registered on the Evolution portal and created your online access, you and your covered dependents will have the option to click on the My Links tab. This tab allows you to either go directly to the Caremark website or the Cigna website to search for a provider. You can also use this My Links tab to access the Teledoc program virtual visits or view your ID card currently on the portal. And if you need a new copy of the ID card, you can even request it from this My Links tab. When searching for a Cigna provider, simply go under the My Links tab, click on Find a Cigna Provider, and it will automatically redirect you to the provider search. Put in your city and state that you're searching. It has already pre-populated the plan, which is the PPO Choice Fund Plan network, and then you can search by either the physician's name, his specialty, a facility, or a hospital. It's very important to keep in mind many physicians work out of different practices, and not all practices are contracted. So if you're searching for a specific provider, you want to make sure the address that's listed in the Cigna PPO network is the address you're seeing that physician at. Because if you see that physician at a different location, they may not be contracted and there will not be any out-of-network benefits for that. Under the My Links tab, you also have the option to click on the Caremark link. This will direct you right to CVS Caremark's website, where you can register and create access to your pharmacy benefits. Evolution Healthcare also has a mobile app for all iPhones and Androids. Simply go out to the App Store and type in MyEVHC Mobile and look for the Evolution logo. Download the app, and if you've already registered on our main website with a username and password, you can access the mobile app using that information. If you have not registered, simply register while you're on the mobile app and create a username and password, which then allows you to have full access to your entire Evolution profile. You can pull up your ID card, request an ID card, you can look at your explanation of benefits, or you can even connect to your My Links to search for Cigna in-network providers or for your Caremark pharmacy vendor.
To the 2021 Open Enrollment Presentation for Diamond Environmental. Your health plan will be effective on March 1st, 2021. MyEVHC Health Plan is a binational health provider offering quality care in Tijuana, Mexico at Excel Hospital. We offer emergency and urgent care services worldwide, including Tijuana, Tecate, Mexicali, San Diego, and Chula Vista. Excel Hospital is open 7 days a week from 8 a.m. to 8 p.m. for any scheduled visits. It is open 24 hours a day, 7 days a week for any urgent care and emergencies. We also have a team of member services available 24 hours a day, the 7 days of the week for any questions or concerns that our member have. MyEVHC Health Plan is offering the VP5 plan. On this plan, you don't have any deductibles, and the maximum out-of-pocket for individuals is $2,000 and $4,000 per family. Primary care visits are only $5. Keep in mind that this copay is only for 1 calendar month. For specialists, you do have to have a referral from your primary care physician, and this copay is $10 per visit. For x-rays and lab work, this plan does not have any copays. In case of medication, we have different tiers. The first tier, it's $5. Tier number 2 is $10, and tier number 3 is $15. Tier number 4 is 20% up to $250 per medication. In the case that you need urgent care services and you cannot drive down to Excel Hospital, you can access our providers here in San Diego area. You have access to the mini clinics inside CVS pharmacies. You have access to La Maestra Community Health Centers on Fairmount Avenue, San Isidro Health Clinics on 3rd Avenue in Chula Vista, and any AFC American Family Care locations in San Diego. We have Vista Community Clinics, Clínicas de la Salud del Pueblo, and Valley Urgent Care. And you would only have to pay your copay of $35. For urgent care at your home or work location, we have the HEAL program. HEAL delivers care using board-certified doctors as well as medical assistants. Services are available 7 days a week, 365 days a year, from 8 a.m. to 8 p.m. However, you do have to be within the coverage area, and your copay of $35 for urgent care will apply. MyEVHC offers emergency services worldwide. If you're in a life-threatened situation, please call 911 and have them take you to the nearest emergency room. MyEVHC will cover you until you are stable, and there are 2 types of emergency visits that you can have. One would be your outpatient visits that you are responsible for 50% coinsurance up to $200. All the follow-up of this visit will be done with our provider, Excel, in Tijuana, Mexico. In the case that you are an inpatient and you do have to stay at the hospital, you will be responsible for 15% of the current insurance up to $2,000. That is your maximum yearly out-of-pocket. After your doctor decides that you are medically stable, you will be transferred to Hospital Excel to continue your care. We are offering virtual care services that are available from Monday to Sunday from 8 a.m. to 8 p.m. To schedule, please contact our member services team for an appointment. In the case that you have a prescription for medication that you cannot pick at Excel Hospital, you may request a Walmart pickup service. The doctor will let you know if your medication falls under the limit formulary of 100 commonly used maintenance medication. If you have any questions about this service, please contact Member Services. MyEVHC offers our dental plan D200. With your plan, you have access to all our dental team in Excel Hospital. And we have a free oral evaluation once a year for you and 2 cleanings a year with no copays. With our vision plan B100, MyEVHC offers 1 free eye exam a year, frame allowance of $100 every 24 months, contacts at $100 every 12 months, and no co-pays on single or bifocal lenses. However, in order to enroll with vision, you have to have medical coverage with MyEVHC. MyEVHC Health Plan introduces the new mobile app with new options. Through MyEVHC mobile app, you can manage your medical, dental, and vision appointments, get answers to the common benefit questions, and connect with member services through WhatsApp. You have your digital member ID there, and you can access you as urgent care providers' locations. You just need to download it from Google Play or from your app stores. Thank you very much. We recommend This concludes our MyEVHC presentation. For further information, you can log on to our website to see videos and testimony of our members. Thank you very much.
Hello everyone. In this online overview, I will provide you a highlight of the Mutual of Omaha benefits. These benefits have not changed this year. This includes the voluntary life, disability, and accident insurance. If you are a newly eligible employee, you will have a one-time opportunity to enroll in these benefits. Let's start off with your life insurance and the importance of having it. The purpose of having life insurance is to provide you and your family security. How much life insurance should you have? That's a great question. Most of us worry about the expenses we leave behind. The immediate expenses, one that most of us worry about, is a funeral cost. Funerals nowadays can range from $10,000 to $15,000, but there are also ongoing expenses and future expenses when you're considering how much life insurance is right for you and your family. There are no changes to the voluntary life insurance this year. If you're currently enrolled, your benefits will continue. If you are a new hire during this open enrollment, you have a one-time opportunity to enroll in life insurance without providing any medical or health questions. Even if you're diabetic or you have high blood pressure, it doesn't matter if you have a pre-existing condition. If you're not a new hire, you are required to fill out a health questionnaire. A reason to consider this benefit if you're not currently enrolled: the plan gives you an opportunity to get life insurance for your family. Even if your employment changes and you part ways with the company, this policy is yours and you can continue to pay for the coverage individually. How much life insurance can you enroll in? Let's take a look. For you, the minimum you can elect as an employee is $10,000. Guarantee issue is the amount you can enroll in without any medical or health questions, which is 5 times your annual salary, up to $150,000, and that is for new hires. Maximum on the plan is $500,000. If you're enrolled, you can also cover your dependents. Your spouse's minimum coverage amount is $5,000. Guarantee issue, again for those new hires without any medical or health questions, is $30,000. Maximum is $250,000. Your children, coverage is minimum of $2,000 and maximum of $10,000. Disability insurance is the second benefit we're going to talk about, and there are no changes to your disability insurance this year. Disability insurance, second to medical, has to be the most important insurance we can have. The reason why disability insurance is your paycheck insurance: if you cannot come to work as a result of an accident, sickness, or injury, disability will pay you a benefit. We insure anything that is valuable to us: our cars, our homes, our health, our cell phones, but without our income, none of that is possible. You have an opportunity during this open enrollment to enroll in voluntary short-term disability. Let me explain how the short-term disability plan works. Short-term disability will pay you when you're out of work because of such things as pneumonia, maternity, or you need to have a surgery. As long as your doctor deems you disabled, you will be able to receive a benefit from short-term disability. You will start receiving a benefit after 8 days, and it will pay you 30% of your weekly salary to a maximum of $1,200. That 30% will pay in addition to any other benefit you receive, including the State of California Disability Plan. That means with the plan and the California State Disability Plan, you will receive 90% of your salary. Benefits are paid out for 12 weeks. The short-term disability has no changes this year. If you're currently enrolled, your benefits will continue. If you're not enrolled, take this opportunity to make sure you protect your paycheck. Now, if your disability went beyond the 12 weeks, there is a voluntary long-term disability plan that you can enroll in. You may be out of work because of an injury or a serious illness like cancer. The plan is there to continue to provide you a paycheck when you cannot work. It pays you after 90 days, and it will pay 60% of your monthly salary to a maximum of $6,000. This benefit will pay you up until your Social Security retirement age if you need it for that long. The long-term disability plan has no changes this year. If you're currently enrolled, the benefits will continue. If you're enrolling for the first time, you must complete a health questionnaire unless you're a new hire. If you're a new hire, please make sure you take advantage of this open enrollment and your one-time opportunity to enroll in this plan without any medical or health questions. You may be asking which plan you should enroll in. I wanted to show you how beneficial it is to have both the short-term and the long-term disability and how they work together. Enrolling in both coverages means no lapse in coverage. Short-term disability will start after 8 days, but only pays you for 12 weeks. If you're enrolled in the long-term disability, once short-term disability ends, it will automatically transition into long-term disability. with no lapse in coverage. Then long-term disability will pay you up until Social Security retirement age. An important benefit to enroll in is accident insurance. How does this benefit work and when will it pay out? Accident insurance pays you a benefit when you seek medical services for an accident. You're probably thinking, why do I need this plan? I have medical insurance. Well, even if you have medical insurance, there is always out-of-pocket expenses like deductibles, medications, co-payments that we worry about paying. This plan is going to pay you a benefit regardless of what your medical plan pays out. Let's take a look at what the accident insurance pays out. Here are the services that are covered and the benefit amounts that the insurance will pay you. The plan will cover the initial visit, which means you get hurt. You probably first end up at the emergency room, or my most frequented spot, the urgent care. Then the plan covers the actual injury, if it's a fracture, a dislocation, a laceration, or a burn. If you need to get admitted into the hospital, the follow-up visits to your doctor, or physical therapy, or maybe you need a medical device, that is also covered. We have listed what the plan pays and how those services add up. There are no changes to the accident plan, so if you're currently enrolled, the benefits will continue. If you're not enrolled, this is your open enrollment and your opportunity to enroll yourself and your dependents. An enhancement to the accident plan is the health screening benefit. The plan pays you a $50 benefit once per calendar year for each covered member. If you have any of the qualifying exams listed on our claim form, most of us will get one of these tests when we go in for our annual physical. Even if your health insurance pays for the exam, you will still receive your $50 benefit. If you're currently enrolled in the plan and had one of the services rendered, please make sure to file your claim. There are no changes to the Mutual of Omaha benefits this year. If you're currently enrolled, benefits will continue. Please refer to your plan summary for plan details, exclusions, and limitations. Thanks again for taking the time to listen to your Mutual of Omaha benefits.